Hello, colleagues. Hello, my friends. Hello, participants. Thank you all the guests who have joined us for this online pre-defense. I would like to introduce myself. My name is Adrián Kiptulon-University. I'm a supervisor to Evans Kasmai. For your information, I would like to note that a video recording will be made during the pre-defense. I hereby open the internal pre-defense now, and I would like to introduce the two preliminary reviewers who are present, Dr. Angelika Szatmári, Associate Professor, and Dr. Krisztina Éles-Gebriné, Assistant Professor. I would like to outline the procedure for the pre-defense. Evans Kasmai will give a 20 minutes presentation accompanied by a PowerPoint presentation, during which the doctoral candidate will also respond to the preliminary reviewers' comments. Following this, I ask the preliminary reviewers to briefly outline the key points of the preliminary review, particularly the recommendations which we have since addressed. Afterward, participants may, if you want to take a question or make a suggestion for improving the presentation of the dissertation. Thank you very much. And now I would like to invite to Evans Kasmai to give a 20 minutes presentation. Okay, Evans, the floor is yours.
Thank you very much, Dr. Shiket. Good afternoon, everyone, and thank you for sacrificing time from your busy schedules to join us today. I don't take it for granted. Thank you very much. My topic is on the impact of organizational culture on work-related stress and career living intentions among nurses, intervention points, and the opportunities to retain nurses in the context of low and middle-income countries. My supervisor, as she has said already, is Dr. Adrián Shiket, and this will be the outline of my presentation. Introduction, the problem statement, the term organizational culture, objectives, overall methodology, sub-studies making up this thesis, novelty, discussion, and conclusions, study limitations and research and future research, and I will say something on the acknowledgement. The problem in this thesis is the nursing shortage crisis in the context of sub-Saharan Africa. Nurses are called the backbone, the heartbeat, the engines and pillars driving healthcare systems across the world. We have about 33 million nurses spread across the world, with 77% being in the high-income countries, leaving alone 23% working and living in the context of low and middle-income countries, with Africa having about 1.5 million nurses, translating to 3 to 4%. Despite nurses being the largest profession, shortage of nurses has been put as a ticking time bomb, with 7.7 million nurses shortage across the world, and this 89% of it being in the low and middle income countries. Complicating the shortage of nurses is what we call nurse turnover, exacerbated by work-related stress, with thousands of nurses every day and every year exiting Africa to the already high density populated region. And this has led to a serious brain drain in the context of low and middle income countries, these countries being unable to deliver healthcare as a human right to people living in these regions. Understanding turnover intention, which all this study is all about, helps us to tackle turnover as well as shortage of nurses. And several pull and push factors have been put across as causing shortage of nurses and turnover. But one such a factor which has been ignored so much in healthcare is what we call organizational culture, which is defined as a complex term, defined as a system of shared values, norms, and behaviors that define how people within a system work together and approach their work daily. It's also defined as simply how do we work within a system, and when it's positive, it acts as a fabric and glue that binds workers together. Good leadership and organizational culture are two sides of the same coin, and studies in psychology and many other aspects, including business and military science, indicate that when organizational culture is toxic, it drives work-related stress and dissatisfaction, as well as living among nurses. However, there is a large gap, especially in context of low and middle-income countries where organizational culture is ignored, their lack of studies, leading to limited specific evidence to guide policies in these regions. Point this research needs to fill that gap. The research objectives, the overall objective is to examine the impact of organizational culture on work-related stress and career living intentions among nurses, identify intervention points and the opportunities to retain nursing workforce. We worked with 5 major specific objectives. 1, to systematically assess the impact of organizational culture on nurses' work-related stress, to validate one of the organizational culture tool in the context of Kenya. 3, to investigate relationship between organizational culture, work-related stress, job satisfaction, and job and professional turnover intention. And 4, to review nurse retention strategies to see what works in sub-Saharan Africa and what is the role of organizational culture. And finally, to recommend based on the findings. On data methods, this is an article-based thesis, one of its kind to be conducted in sub-Saharan Africa, making up 4 sub-studies. All the sub-studies has been published in high-impact journals. This design was chosen due to complexity of the research problem and to comprehensively address it and the desire to build evidence progressively. Our first study, which published under the title Transforming Nursing Work Environments, the impact of organizational culture on work-related stress among nurses, was a systematic literature review which followed all the protocols of conducting a systematic literature review. The objective was to determine the scientific evidence in literature on the impact of organizational culture on work-related stress and provide valuable insight on mitigation of work-related stress. Through several stages of the search we did in several major databases, including PubMed, Scopus, and Embase, among others. And through several stages of screening and eligibility, we included 13 articles. We did thematic analysis due to heterogeneity of the results. And we got 3 major themes: organizational climate, organizational politics, and organizational culture types. And on overall, we found that positive organizational culture and climate and positive organizational politics were found to be protective factors against work-related stress, working analogously like stress vaccine. What do I mean? Positive organizational culture where nurses are valued, where they are respected, there is authentic leadership in an organization, there is leadership support, also through collaboration and teamwork, among other positive values of what we call positive organizational culture, work together as stress vaccine, and also where organizational climate, otherwise defined as perception, and the feeling where nurses feel like there are these positive factors, stress reduced. Also, positive politics where meritocracy supersedes any other activity within a system in promotion and also suppression of discrimination. However, we found a major gap in this study that there were lack of studies in the context of low and middle-income countries, including validated tools. Leading us to the next study, which was the validation of psychometric properties of practice environmental scale of work of nursing work index. This is a tool which was first developed in the USA. We aimed to validate this tool, and the setting was in 36 major hospitals across Kenya, giving a response of 212 nurses. We did analysis using SPSS EMOS, and we checked Cronbach reliability using Cronbach alpha and validity using exploratory factor analysis and confirmatory factor analysis. On our results, we found the original 5-factor scale was not supported, and a new factor scale, a 7-factor scale of a Kenyan version, was developed. The new tool was reliable with all the 7 subscales having Cronbach alpha more than 7, and the overall being 0.939. On exploratory factor analysis, the results, the tool had high sampling adequacy with all parameters showing high adequacy. It had also good model fit with also parameters including Ramsey showing good model fit. This confirmed the tool as suitable for measuring nursing organizational culture within Kenya. And the study also confirms an important methodological principle that measurement tools developed in high-income countries should be revalidated in the context of low and middle-income countries. Our third sub-study published under the theme Intentions to Leave the Job and the Nursing Profession Among Nurses in Kenya Referral Hospitals, exploring the effects of organizational culture on work-related stress and job satisfaction, was a cross-sectional study among 429 nurses across 14 major referral hospitals in Kenya. The aim was to explore the effects of organizational culture on work-related stress and job satisfaction on nurses' job and professional turnover intention in Kenya. We used validated tools to measure organizational culture, work-related stress, job satisfaction, turnover, and professional turnover intention. We used SPSS as well to analyze and tests were chi-square correlation, logistic regression at 95 confidence interval and a p-value of 0.05 showing significance. And to summarize these findings, we found that organizational culture in Kenya on a scale of 1 to 5 was largely neutral, where below 2.5 being negative, 2.5 at 2.5 being neutral, and above 2.5 being positive. We found organizational culture in Kenya being largely neutral. We also studied work-related stress among nurses in Kenya, and the tool coincidentally were the same in terms of how they are measuring these two parameters. And we found that work-related stress in Kenya was moderately high on a scale of 1 to 5, also with 3.5 being high stress, 3 being high stress, and below 3 to 2 being moderate. We found work-related stress being moderate in Kenya. We also found that intention to leave job among nurses, either within the country or exiting to other countries, was 81.4%, while intention to leave nursing as a career was 31%, and job satisfaction being 56%. Predictors of job turnover intention, we found that age group, work experience, with nurses who are having lower experience and younger, showing lower turnover intentions compared to those who are highly experienced. Also on professional turnover intention, we found that marital status, ward, and salary were the major factors, with nurses who are married showing higher intention to leave the profession. Also those working in high intensive unit, surgical ward, renal unit, and others showing higher intention to leave the profession. Salary, lower salary also showed higher intentions to leave. Job satisfaction was the strongest predictor, predicting both intention to leave the career and the profession. Work-related stress also predicted professional turnover intention. However, the surprising results in this context, especially in Kenya, we found that while nurses were highly stressed, they didn't want to leave nursing as a career. Not as a career, as a job within where they were working. And this was due to what we call locked-in workforce phenomenon, where there are limited employment alternatives, there are financial insecurities, strong professional commitment, and also prolonged exposure to stress, fostering resilience, endurance, and adaptability. Therefore, low turnover should not be mistaken for a healthy work environment, especially in low and middle-income countries. Organizational culture in both cases did not directly influence turnover or professional turnover intention. Our last study, under the title Retaining Nurses in Sub-Saharan Africa, a Systematic Review and Meta-Analysis, was a meta-analysis which followed all the protocols of conducting a meta-analysis. We included 31 studies, and on the results, we found that retention of nurses within Sub-Saharan Africa was extremely low at 53%. Also, intention to stay was also low. And on subgroup analysis, we found that East Africa had the largest intention to stay in nursing, followed by West Africa, and lowest in Southern region of Africa. We found Sub-Saharan specific unique high-impact intention strategies or intervention points as production of nurses, financial and non-financial incentives, career and professional development opportunities, high involvement, fair and predictable resource, human resource, supportive work environment. Rural housing also was another major factor across many studies where if countries construct rural houses, nurses were more retained. Also, lower costs of living in rural regions, types of employment, especially permanent employment, nurses being employed on permanent terms, being retained in the region. Good leadership, facility level improvements, improved image of nursing over time, especially in countries like Kenya, Uganda, studies showed this. Also, religion, especially in the region of Muslim part of Africa, where respect to religion, availability of worship places were also retaining nurses, and finally attraction of nurses. This study also showed that there were many challenges in retention of nurses in sub-Saharan Africa, including high unemployment rates, inadequate healthcare funding, poor governance, poor remuneration, poor working conditions, political interference, especially in Kenya and Nigeria, training challenges, including lack of lecturers and even training facilities, ineffective mobility management, active recruitment of wealthier nations. On the novelty of this study lies some, I summarize in three factors. One, the conceptual focus or conceptualization of organizational culture as an important predictor of work-related stress and turnover intention among nurses in sub-Saharan Africa. This is the first study to do that. And also, secondly, the methodological innovation. This study delivered one of the very important tool to measure organizational culture in Kenya, which could also be used to measure organizational culture in other parts of Africa. And thirdly, the empirical evidences. This study showed a high turnover intention among nurses in Kenya, also high professional turnover intention and low job satisfaction. And it identified key predictors, including that neutral organizational culture does not directly or significantly inform the decisions of nurses to exit directly. And contrary to many existing studies, work-related stress inversely predicted turnover intention. It as well showed other results that retention and intention to stay is low, and identified sub-Saharan specific, unique, high-impact retention strategies while uncovering key challenges, offering actionable evidence that if sub-Saharan Africa countries implement, could strengthen nurse retention across the region. And this, on discussion, this is the first thesis to use integrated multi-stage research design in organizational culture study in sub-Saharan Africa, and it showed extremely high exit and poor retention strategies in the region. It also validated the tool I already mentioned, and the meta-analysis and the systematic review showed that positive organizational culture is a key predictor of work-related stress and turnover intention. And the empirical studies showed also that largely neutral organizational culture did not have or predict turnover and professional turnover intention, while the strongest factor was the job satisfaction. Therefore, policy should focus on organizational culture and satisfaction together to enhance retention of nurses. The recommendation and take home from this study is that no single intervention, I can say, is enough to retain nurses in sub-Saharan Africa, but rather an integrated model, which includes positive organizational culture together with focus on the sub-Saharan specific, unique, high impact retention interventions, where we focus on positive organizational culture factors together with World Health Organization recommendations. Together, we would be able to decrease work-related stress and also decrease turnover and turnover intentions and increase job satisfaction, and finally enhancing sustainable nursing in context of sub-Saharan Africa. The limitation of this study, the systematic literature reviews, it was only English sources, and we did not also include unpublished data. Therefore, an important information could have been left out. Also, the limitation of cross-sectional study, for example, cross-sectional studies cannot establish cause and effect. It's a snapshot and also cannot determine incidence, but rather only prevalence. So other studies for future, studies should use longitudinal or mixed methods designs or conduct cross-country studies or interventional studies and include maybe other healthcare workers, and probably also include, we know Africa is a multilinguistic region with English, French, and even Portuguese. They can study in that context. From this study, my publication together with my contribution, we had an impact factor of 4.5. Otherwise, on acknowledgement, I want to really acknowledge God and my supervisor and everyone, including our reviewers, Christina and Angelica, and everybody who in one way or the other, including my fellow PhD students, and most importantly, the Hungarian government and the good, generous people of Hungary who gave me the scholarship I'm on today to be able to do this research. And thank you for all of you. I want to end by quoting a statement from the previous president of America, Barack Obama, who said, "Change will not come if we wait for some other person or some other time. We are the ones we have been waiting, and we are the change that we seek." To all the people, especially those who come from low and middle income countries, I say we are the change that these countries have been waiting for. We are the ones to transform our healthcare systems and also retain our nurses or other healthcare workers. Thank you for your kind attention. Thank you very much.
Okay. So thank you for the presentation, Ivans. Congratulations. I think it was punctual 20 minutes, okay? So it's absolutely correct time. So I would like, please briefly summarize the recommendations of the two reviewers. Firstly, I would like to ask to Christina, please summarize the recommendation, okay? The floor is yours.
Okay, thank you. Firstly, I gratefully acknowledge your kind invitation to review to above-mentioned PhD dissertation proposal, which I have evaluated as follows. The topic selected for Ivans Kasmai Kiptulon's PhD dissertations is highly relevant and scientifically well-founded. The shortage of nursing staff, work-related stress, and career abandonment represent global challenges today, particularly in low and middle-income countries, including the sub-Saharan region. It should be noted that the relationship between organizational culture and work-related stress has already been widely discussed in the international literature. The innovative character of the dissertation is primarily geographical and contextual, while the theoretical approach can be considered less novel. At the same time, the research is gap-filling in nature, as relatively few empirical studies in this region have explored the relationship between organizational culture, work-related stress, and intention to leave the profession. The dissertation contributes to the expansion of international health sciences research and also has practical relevance for health policy decision makers and institutional leaders. In preparing my evaluation, I first summarize my remarks concerning formal aspects, followed by substantive consideration. Now, I won't read all the editorial errors listed here, but I'd like to ask the doctoral candidate if they were able to make the suggested changes. Okay, the methodological evaluation. The author applied a complex multi-method research approach, including systematic literature review, instrument validation, cross-sectional empirical research, and meta-analysis. The methodological framework is up-to-date, and the statistical procedures are appropriate and well presented. The detailed description of sampling data collection and data analysis enables the reproducibility of the research. It should be noted that the underrepresentation of rural and lower level healthcare institutions may bias the results. Particularly noteworthy is the validation of the PES-NVI instruments, which represent a significant methodological contribution to the research infrastructure of the studied region. However, the process of cultural adaptation, translation, back translation, and so on is not described in sufficient details. The raises questions concerning the full cultural appropriateness of the instrument. I therefore request clarification and elaboration of this section. The limitation of the research are presented appropriately by the candidate, especially those arising from the cross-sectional design. I also congratulate the doctoral candidate on publishing in well-established academic journals. In the following, I would like to highlight the new findings based on the dissertation. The main scientific contributions of the dissertations as follows: comprehensive validation of the PES-NVI instruments in the Kenyan context, provision of empirical evidence on the relationship between organizational culture, work-related stress and job satisfaction in an LMIC setting, identification of high levels of intention to live among Kenyan nurses, regional level meta-analysis on nurse retention, and identification of specific context sensitive intervention points. Note, in several cases, the theoretical conclusions confirm the findings of previous studies. It should be considered that in several analyses, organizational culture did not prove to be a significant predictor. Nevertheless, the candidate attribute substantial importance to it in the conclusions. My overall opinion, the dissertation analyzes and presents original research results. The applied research methods comply with social sciences and sociological research practices and are appropriately aligned with the topic and objectives. Despite the critical remarks outlined above, the dissertation represents scientifically valuable and relevant contributions. The author has demonstrated the ability to design and conduct independent research and to publish at the international level. The identified shortcomings are primary editorial, structural, and interpretative in nature, and do not fundamentally call into question the doctoral level quality of the dissertation. If the reported errors have been corrected, I consider the dissertation suitable for submission to public defense. Thank you.
Okay, thank you very much, Christina. I would like to ask Ivans, to give answers.
Thank you very much, Dr. Shiket. I would wish to clarify that I wish first to thank the reviewers for accepting to review for us this thesis. And I would want to clarify that all what Dr. Angelica raised were like we did the corrections, all of them. And I thank her so much for what she raised, and all those she mentioned, we've already did the corrections and resubmitted. And in fact, you could see from my presentation, especially even the last part was part of what she told us to correct. I really thank her and thank you very much. And the only part she mentioned on the tool, the strengthening of the tool, especially on back translation. We understand in Kenya is an English-speaking country, and the tool did not really warrant to retranslate because Kenya is an English-speaking country. So the tool was appropriate to use in the context of the same language without retranslation. Thank you very much.
Okay, thank you. I would like to ask to Angelica to summarize the recommendation. Okay.
Thank you so much. The first, I would like to congratulate for the results for the topic. Thank you for your clear and well structured presentation. This dissertation addresses is a highly relevant and timely global health workforce problem. The persistent shortage of nurses in low and middle income countries, particularly in sub-Saharan Africa, with a strong empirical focus on Kenya. By examining organizational culture as a core, but underexplored determinant of work-related stress, job satisfaction, and career living intentions, the thesis makes a substantial original contribution to nursing science, health systems research, and workforce policy. The work is ambitious in scope, methodologically rigorous, and theoretically grounded. The article-based structure is coherent and well integrated, allowing the author to build evidence progressively from global synthesis to local empirical validation and policy-relevant conclusions. The dissertation is logically structured and clearly written, scientific relevance and originality. Contextual contribution. The focus on Kenya and sub-Saharan Africa fills a major gap in the literature, which has been dominated by evidence from high-income countries. Methodological innovation. The psychometric validation of the practice environment scale of nursing work index in the Kenyan context is particularly valuable, as it provides a culturally sensitive and empirically sound tool for future research in low and middle income countries. Evidence integration. The combination of systematic reviews, meta-analysis, instrument validation, and cross-sectional empirical research represents a comprehensive and well-justified mixed methods approach. These elements collectively demonstrate a high degree of originality. Methodology. The study demonstrated a strong methodological rigor through 4 complicates with the PRISMA guidelines in a systematic review, the use of reliable regression-based statistical analysis, and the transparent presentation of limitations. Additionally, the empirical work is supported by adequate sample size and well-justified analytical methods, which together enhance credibility and robustness of the findings. The findings are clearly presented, well interpreted, and consistently linked back to the research questions and the existing literature. Key contributions include clear evidence that organizational culture significantly shapes nurse work-related stress, validation of context-specific practice environment scale of nursing work index model for Kenya, nuanced insight into predictors of job and professional turnover, intentions, identification of culturally and structurally relevant retention strategies in sub-Saharan Africa. The conclusions are well supported by data and avoid overgeneralization. Practical and policy implications. One of the strongest aspects of this dissertation is its policy relevance. The author translates empirical findings into actionable recommendations for health system leaders, nurse manager, policymakers, and the national and regional levels, and international organizations concerned with workforce sustainability. The emphasis on organizational culture reform as a lever for nurse retention is both evidence-based and practically meaningful. Overall, the dissertation meets and in several respects exceeds the academic standards expected of a doctoral thesis. Several revision suggestions. General introduction, explicit articulation of the research gap, a short subsection titled Research Gaps Addressed by Thesis, this thesis, would strengthen the chapter by clearly distinguishing this work from existing literature. Strengthen low and middle income countries and sub-Saharan Africa relevance. In the discussion, explicit link global findings and the low and middle income countries and the sub-Saharan Africa context, emphasizing how cultural, incoming and organizational constraints and intensify the identified stress mechanism. Strengthen justification for scale adaptation, elaborate on why the original 5-factor practice environment scale of nursing work index model might be conceptually misaligned with the low and middle income countries on Kenyan healthcare context. Clarify factor interpretation, provide brief practice-oriented explanation of each of the 7 factors to illustrate how they manifest as everyday nursing work environments in Kenya. Chapter 4, suggested revisions, deep interpretation of counterintuitive findings, the intensive relationship between work-related stress and turnover intention warrants deeper discussion. Consider exploring explanations such as encoding constant professional commitment of the logged-in workforce phenomenon. Chapter 6-8, general discussion, novel findings and policy implications. These chapters effectively integrate findings from all sub-studies with clear emphasis on intervention points and the practical relevance. Develop an integrated intervention framework, the summary table or model linking organizational culture dimension to specific intervention strategies would strengthen the applied contribution of the dissertation. In conclusion, the dissertation represents a highly quality, original and methodologically sound contribution to health science and nursing workforce research. The author demonstrates the doctoral level competence in theory, methodology, critical analysis, and scholarly communication. Reviewing Evans, Kasmai, Kiptulon's academic work, it can be concluded that, based on his published articles, he meets the requirements of the doctoral school, and his dissertation provides that he is capable of raising and answering independent academic questions. Thank you so much.
So thank you very much, Angelica. And now I would like to give Evans the opportunity to respond.
Thank you once again, Dr. Shiket, and thank you very much, Dr. Angelica, for the wonderful and positive review of the thesis. I'd wish to say all the points you've raised were very important for us in coming up with the final thesis. We condensed the background as you had given us or suggested. We also included a model in terms of illustration of organizational culture, work-related stress, job satisfaction, and turnover intention for clarity, as you had raised. Also, we added a small title, especially titled Research Gap Addressed in the Study, as you had already advised us to do on the same. The discussions on strengthening low and middle-income countries and sub-Saharan relevance, and on the discussions, we did also the same. We discussed more, and we strengthened also the rationale of adaptation. We discussed on the same, on the final thesis. We clarified also and interpreted the factors you mentioned, especially the results, which were contradictory, into what other literatures have already raised, especially on the part of work-related stress being like what I already said in terms of what I was presenting briefly on the locked-in workforce phenomenon, where nurses are stressed, but they don't want to leave nursing as a profession. And we raised more points on why this was happening, especially in the context of Kenya, that there were job or financial insecurities. Also, nurses have over a long time have been subjected to stress, which has built resilience, adaptability, among others. We explained in our point-to-point response, which we had already sent, and everything that you raised, including the summarizing the intervention points into a model, which we really found that it was something which was missing, but when you reviewed and advised us on this, we corrected. Thank you very much, and we really appreciate for your review, Dr. Angelica. Thank you very much.
Okay, thank you, the answers. Yes, thank you. Now I would like to ask to the participants if they have any further questions or comments or suggestions. It's possible, okay, to use the camera. Oh, yes, Said. Okay, Said, please try to ask, okay?
First off, thank you for your presentation, and I appreciate the invitation to your thesis defense. I found it to be very incredibly thorough, and I really liked your methodological approach to the topic. Coming to my question, it's that in your subgroup analysis, you presented intention to stay data for East, West, and Southern Africa, but why was Northern Africa not included, and how might its inclusion affect your overall findings?
Thank you very much, Saad. Should I proceed, Doctor?
Yeah. The floor is yours. Yeah.
Thank you very much, Saad. Truly, we presented the data for East, West, and Southern Africa, where we found that East Africa nurses had more intention to stay, followed by West Africa, and finally, the Southern Africa having the lowest. We did not include the countries from the Northern Africa. As you know, Africa is divided into two at the mid. The northern regions are not considered as sub-Saharan Africa. Therefore, we did not include their data. But however, if we were to include the data from the northern part of the region, which are a little bit developed than the countries from southern region or sub-Saharan Africa, I think intention to stay would also increase, as we know these countries, including Morocco, Tunisia, Libya, among other countries which are a little bit developed and closer to Europe. I think it will increase a little bit the intentions to stay and also the retention. However, we did not include basically because they are not part of sub-Saharan Africa. Thank you for your question. Hope to have responded.
Yeah, it was clear. Thank you so much.
You're welcome.
Okay. So, Said it was a good answer for you?
Well, yeah, it was very thorough.
Yeah. So I would like to ask if they have any further questions or comments or said, yes, Ariana. Yeah, okay. Hello.
Hi, good afternoon. I'm Ariana, I'm a third year nursing student. So my question is, what was the most surprising findings in your research?
Thank you very much, Ariana. As I said earlier on, the surprising results is the fact that nurses in the context of Kenya, nurses were really stressed, but they did not want to exit nursing. If you look literature from other countries, it indicates that when a nurse, for example, is stressed at work, they intend to exit, go to another place, look for another job elsewhere. But in the context of Kenya, you saw my presentation, they didn't want to exit. And I said, this is surprising. It's not normal in context of someone being stressed and you continue working in the same place. But however, we explained by the what we call locked-in workforce, like where nurses could not have an option to exit to. That's what they explained, and also resilience over time due to stress, and this is surprising. Thank you very much.
Thank you. I have one last question.
Okay, Ariane, it was good answer for you?
It was good. It was good.
Yeah. Okay, thank you. So I would like to ask if they have any further questions or comment or suggestions. Christina, yeah?
Okay, I have a few suggestions regarding the PPT's format.
Yeah,
It is possible. Okay. Evans, your flow diagrams text is
small.
Yes, it's small, very small, and makes difficult to read it.
Yeah.
And the sub-study 3, the red indicator cycle, okay, should appear later. Firstly, the table, and you presented the results, and timing the red circle. Okay, and in the case of predictor table, the significance level that used, the analysis could be right. For example, 5%. Okay.
Okay.
Yeah.
The result PPTs 2 ábra, hogy van ábra? Nem tudom. Tehát a kettes ábrának is a felirata
Diagram. Table.
Diagram felirata not
was good. Yeah.
Not read easily. Okay. And perhaps the names of the principal components of the modeled factors could be included. The original 5 factors and the newly 7 factors.
Okay. Thank you very much, Christina. I agree. I'm very sorry. Yesterday evening, I saw this situation because by online Teams is not same situation than the real time. So the normal PPT is a bigger one, but at the moment the text is very slow. The letter is very slow. So I'm very sorry. I think the too much the text and I recommendation to Evans it would be too small letter. Okay.
Yeah. I think I will correct. Thank you very much for that suggestion. We will correct before we do the final presentation of the thesis. Thank you very much.
Yeah. Okay. If they have any further question, comment, or suggestion or PPT now, okay. Yes, Dahago. Yeah. Yes, the floor is yours, Dahago. Yeah. No sound.
For me, I don't have a specific question, but just want to congratulate Evans for that good presentation. I know this topic is timing, especially right now there is a lot of nurses which are moving out of the country, but not the same to Kenya. But mine is just to say thank you, and I hope that we'll go back home and disseminate information for the policymakers at least to take over for recommendation.
Thank you very much, Dahabo. I really appreciate. Thank you very much.
Yeah. Okay. So if they have any further questions, now? Okay. Any? Yeah. Okay. Finally, thank you for all the participating. I close this pre-defense ceremony, and I wish you have a nice day and good health for you. And thank you very much for the participation. Okay, thank you. Hello, everybody. Thank you.
Hello.
Hello.
Thank you. Bye.
Bye.
Okay,
Thank
I
you.
try
Bye-bye.
to stop the video record. Okay. Thank you.